Hello, my name is Nancy Schad, and I'm a safety consultant for OFIA. OFIA is led by the vision that all children and youth value and enjoy the lifelong benefits of healthy, active living. OFIA is a not-for-profit organization established in 1921 and incorporated in 1990. For more than 90 years, OFIA has been taking action on behalf of children and youth. OFIA manages more than 30 active programs and supports the development of healthy schools and communities across Ontario through partnerships, advocacy, and quality program assistance. The Ontario Physical Education Safety Guidelines are one of these supports. OFIA's partners include more than 100 provincial, national, educational, and health sector partners. The Ontario Physical Education Safety Guidelines include the minimum standards for risk management practices for school boards in curricular physical education, inter-school sports, and intramural or house league physical activities. The safety guidelines also include the Concussion Protocol, developed in partnership with the Ministry of Education, Think First Concussion Education and Awareness Committee, and the Recognition and Awareness Working Group of the MTBI Concussion Strategy. The Concussion Protocol addresses all of the components of the Ministry of Education's Policy Program Memorandum 158 for school board policies on concussion. It was released in March 2014. The Ontario Physical Education Safety Guidelines Concussion Protocol is recognized as the minimum standard for all publicly supported school boards in Ontario. This protocol includes a variety of prevention strategies, identification procedures, and sample tools for school use, as well as management procedures to assist students in their return to learn and return to physical activity. OFIA has assisted in concussion policy development for Ontario's publicly supported school boards through a variety of methods. It has produced webinars for all boards and public health units, provided consultation, support as requested by individual boards, and created the PPM 158 Collaboration Ning that provides an online sharing community for school boards and community partners. It also provides access to concussion resources, FAQs, checklists, and templates. OFIA also continues to provide implementation support for school boards and their staffs through the Ontario Physical Education Safety Guidelines. This educator resource includes safety criteria for student participation in curricular, intramural, and interschool programs and is reviewed and revised annually, and concussion prevention strategies in the generic section, activity pages, and in the appendices, specifically Appendix C5, the Sample Concussion Prevention Strategies. OFIA also provides an online concussion training webinar for teachers, coaches, and school staff, in-service workshops for individual boards on their concussion protocols and procedures, and on the Safety Guidelines website, there is an Ask the Expert function. In addition, the Niagara Concussion Summit presentation provided boards with the opportunity to share implementation strategies, challenges, and solutions. What is working? The Ministry of Education, recognizing the seriousness of concussion in school-aged children and the importance of safe management of concussion, issued PPM 158. Boards use the Ontario Physical Education Safety Guidelines Concussion Protocol in the development of their own concussion policies and procedures. They are using OFIA's sample identification tools and developing and implementing management procedures that include return to learn and return to physical activity plans. Many boards are creating their own resources to support students in their return to learning. For example, Halton has the Concussion Education e-learning modules for grades 3, 6, and 9. And many others have concussion education resources for coaches, parents or guardians, and community partners. What is not working? There is still work to do with regard to the communication and alignment of local board concussion procedures and the medical doctors or nurse practitioners that practice in each of the regions. Concussions that occur outside of schools have the potential to cause problems because of a lack of communication and coordination of concussion management procedures between the school and outside groups, i.e., which group will be responsible for providing and monitoring the return to learn and return to physical activity plans. How can these procedures be coordinated among the groups? Another concern is that some sport and many recreation programs do not have concussion protocols. Currently, the tools used in the identification of a suspected concussion are more appropriate for students 13 and over, so there is a need to accommodate concussion identification procedures and tools for the younger students and those with special needs. We would also like to know if there are differences in concussion management practices, i.e., in the return to learn plans that would be more effective for the younger students. What are we hoping to get out of the Pediatric Symposium? Information and strategies based on current research appropriate for students 4 to 12 years old regarding suspected concussion identification tools and management strategies for a diagnosed concussion, and management strategies and approaches to support those with prolonged concussion symptoms. Also, concussion identification and management strategies for students with special needs and those with emotional difficulties during concussion recovery. And finally, some best practices in prevention strategies and additional information on the merits of baseline testing. In summary, OFIA is pleased to be involved in the International Symposium on Pediatric Concussion. Although there has been incredible progress in concussion identification and management in school-aged children, we are looking forward to learning and implementing age-appropriate strategies for the younger student to provide the best opportunities for all children and youth to enjoy the lifelong benefits of healthy, active living.